Fantastic amateur dramatic performance there from the Minister. The Whakatane Amateur Dramatic Society's never looked so good, has it? What the Minister is failing to remember is he raised a couple of issues there. Firstly, closing the gaps. I remember the National Party telling us that closing the gaps was a racist policy. That's what the National Party told us. So now the Minister stands up and proudly says, well, we've done it. Selective memory from the Minister on smoking too. Because I know that Minister and all bar two of his colleagues opposed every measure that this party tried to bring up on smoking. Who opposed the Smoke-Free Environments Act, Mr Ryle? Did Mr Ryle oppose that? Mr Ryle opposed that bill. Old Smokey over there, the Associate Minister, he opposed it as well while he was blowing cigar smoke all over people. This government over there has no credibility to lecture this party here on smoking cessation because they opposed all the measures that our government put up, and Labor stands proud behind people like Steve Chadwick and Annette King and Helen Clark who brought those measures into place. But Mr Ryle seems very concerned about the notion of patients going to Australia. He seems very concerned about the notion of patients going to Australia, other than the fact that, of course, under national cancer patients actually did go to Australia. But I tell you who Mr Ryle should actually be worried about going to Australia. He should be worried about doctors and nurses going to Australia. A 300% increase in the number of doctors, 300% increase in the number of doctors going to Australia in the last 2 years. A 300% increase. That's what he said. That's right. That's what he said. But actually, 300% increase in the number of doctors going to Australia. That's the move to Australia that the Minister should be worried about. Because, Mr Chair, it's all smoke and mirrors with this Minister. It's manufactured targets. It's being able to show off your little league table. But the reality is, for people on the ground, healthcare is now less affordable and less accessible than it was previously. Because this government has decided to focus on its cheerleading targets rather than on the actual needs of people in New Zealand. And we have to remember that the cuts that have come to some of the most vulnerable people in our community. The cuts that have come in aged care, people being called over the phone, asked, how are you feeling? And at the end of it, receiving a cut because somebody says they're feeling okay. My constituent's father, a 92-year-old war veteran, who was called up and asked over the phone how he felt and had his home care cut and was only found on the ground after a fall in his house after several hours by a neighbour because his home care was cut by this government. That's the kind of cut that we've seen under this government. We've seen cuts here in my own region in Wellington to programs in sexual health, in community mental health. Organisations who have worked for years in mental health and community mental health have had their funding cut by this government. And because the Minister doesn't have a target for mental health, the DHBs look somewhere else. The Minister doesn't have a target for public health, so the DHBs look elsewhere. And this Minister likes to shove the problem off to other people. And we would like to see evidence of the 500 doctors who were fathomed up from somewhere by the Minister. But the problem for this Minister and the problem for this national government is that the affordability and accessibility of health care have declined under this government. And in the future will decline further as the amount of money needed to go into health is simply not being invested. This Minister might be able to throw his arms around in the air and tell us all in his dramatic style about all the wonderful things that he's done, but the truth is that on the ground, faced with an increased cost of living, faced with the inability to put a healthy meal on the table for many people because it is now too expensive, people are making choices about whether they and their family can access primary care on the basis of how much money they have. And, Mr Chair, that is not the New Zealand that I want to live in. I want to live in a New Zealand where people know that they can get quality health care and that cost is not a barrier for them. Primary care, public health and prevention should be the priority. Sadly for this Minister, it's manufactured targets and slogans.
Ian Lees-Galloway.
Mr Chairman, there are people